You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile, made to your smile, can make a big difference. With us, we have an expert on the topic of smile makeovers, Dr. Greg Pitts. Dr. Pitts, welcome to the program.
Thank you. Glad to be here.
Now, before we get into today's topic, for people that don't know you, tell me a little bit about your practice, who's your typical patient,
Sure.
and what are the different procedures that you do?
Okay. I'm located in American Fork, Utah. It's kind of halfway between Salt Lake City and Provo. We do a lot of different procedures in our office. We love to help people have optimal oral health. We want people to have the beautiful smiles, they look good and feel good. And the procedures that we do include everything from orthodontics, traditional orthodontics and Invisalign, to oral surgery and sedation, and a whole slew of restorative
So you do veneers,
techniques.
you
We do veneers, we do crowns, we do pretty much metal-free restorations. We kind of get away from all the metal type of restorations that most people have had at one point in their life. We're trying to get away from the products and the techniques and the abilities of the new materials are so greater now that we can make things look very lifelike, very natural, and very aesthetically pleasing.
I think one of your slogans, either I read it on your website, is like you change lives one smile at a time.
Correct,
Elaborate
yeah.
on that. I mean, you believe that?
Sure, we absolutely, and it happens every day.
Okay.
When we can give somebody their self-esteem, their self-confidence, their self-worth back by, they're not embarrassed about how they look, how they feel. We had a woman the other day. She came in and she was just basically so excited to finally have this done. She'd been waiting 17 years to have this procedure done. And she was in an accident. She'd broken a bunch of her front teeth. And so we went in and basically gave her the smile of her dreams. And she just broke down in our chair and just started crying. And she was hugging my assistant. She was hugging me.
Okay.
And it was just one of those life-changing experiences for me to see her have that.
But you see that all the time. Or
On a daily
smile will
basis.
change their life.
Absolutely.
Now, you have a nice smile.
Thank
which
you.
is nice. You don't look like
Appreciate
a dentist, by the way.
Well, thank
Do
you.
people tell you that?
All the time. I don't fit the mold.
What do they think you look like, by the way? Do they say?
High
Football
school
player?
football coach,
Okay.
something else. Maybe
And you're
construction.
you're 6'5".
I am.
And you're very fit. Former football player.
Sure.
Tell me a little bit about that. And when did you know you wanted to be a dentist?
Well, when I started my college career, I was kind of trying to figure out what I was going to do. I knew that probably football wouldn't last forever, so I started taking some classes. I had some mentors who were really close to me, who were dentists, oral surgeons, general practice, and I just wanted to kind of spend some time with them. And they kept encouraging me, like, it's a great career, you'll love it. So I'd go in and spend time when I didn't have time at school or football practice, and I'd watch them work, and I'd meet their patients, and I'd see what they did, and it really intrigued me. And I spent a lot of time getting to know them and how it all worked. And so then I kind of started taking the classes that were preparing me to the prerequisites for dental school. And so that kind of got me on the fast track into dental school. So when football ended, I had something to go right into. And that's been a great blessing.
And you
in my
like
life.
it? You like it
love
more than you expected?
I love it more than I expected.
Why?
I'm passionate about what I do because it's one of those things where you can make a difference in every patient's life. And you can see them excited about their life and how things improve and how they can be better at what they do.
Okay, good. Now, what are the different categories of, we're talking about smile makeovers or how small improvements can make a big difference. What are the categories of cosmetic dentistry, if you had to categorize?
Yeah, sure. It could be even looking like a spectrum, from black to white. Something very simple like tooth whitening, brightening your smile. It gives it more youthful, younger, prettier look, not so stained and discolored.
Okay.
As we go through our lives, as we eat and drink foods and beverages, all those things are going to stain our teeth. And so if we can brighten those up and give a more youthful look, something as simple as whitening your teeth is going to be a cosmetic
So whitening
makeover.
is hot. Is that like a big part of the practice?
Well, we do it every day, and,
Okay.
and people love it, and it's some of what I call a semi-permanent treatment, because you're going to continue to eat and drink those foods and beverages that stain your teeth, so you need to kind of maintain the whitening. So it's something we do every day in the practice.
All right, what else? What are the other cosmetic procedures?
The other range of the spectrum would be implants or titanium posts that are surgically placed in the mouth where people have missing teeth. They have it, to me, it's the best way to replace what God gave you and give you an opportunity to restore your smile again. And so we can use
dental implants.
Dental implants.
You can match them up.
We can match them up perfectly. So the key is we can have an opportunity so patients can have a restoration or a crown on an implant that'll look just like their natural tooth growing out of their gums.
Okay.
And so it matches with everything. We want everything to look like nothing was ever done. If it looks like you've had something done, we haven't done a good job.
Okay, good. Now you have porcelain veneers. You do a lot of veneers.
We do a lot of veneers.
And this other type of veneers. which is
minimal prep veneers. Sometimes people are born with really small teeth. All we need to do is go in and cover them with porcelain. We don't even have to adjust
a lot less
don't have to
expensive.
take the enamel. Similar in cost because we have to do all the steps involved. But the nice thing is we're preserving your natural tooth structure. So we never take that away. We just add to what you're missing.
Now, in the name of your practice is also sports dentistry.
Correct.
So you do a lot of the athletes.
We do. We work closely with Brigham Young University and Utah Valley University and a lot of the local high schools as well. And we help with making their mouth guards to prevent traumatic injuries. Most of the patients that we're helping with cosmetic smile makeovers have had some traumatic episode that they've had something done as a teenager or earlier on in their lifehood, and it's just kind of caused a lot of problems. And so we have to go in and correct that and prevent that. And so if we can help that, that's kind of a fun part of our practice.
Now, after dental school, I mean, you are big on going to courses about cosmetic dentistry. Is there really that much to it?
There's a lot to it. There's a lot more than you'd think. Basically dental school just teaches you the basics, and they give you an opportunity to kind of learn the standard of care, which everybody's required to get the minimum. And so going to more education on a consistent basis, I feel like I can't get enough of it. And the more I can help my patients be the best clinician I possibly can, the better results we're going to have. So the more education, the states require a minimum, and I try to exceed that by 5 or 10 times every year. So
good.
I love doing it.
Now, of course, you're a dentist, and you think the smile is important. How important is the smile, in your opinion?
The smile is the most important thing. I heard it said one time that the smile is the most important thing you can wear, and I really believe that because, literally, if you don't feel good and you don't feel the confidence that your smile produces, then you're kind of hiding behind yourself. You're putting your hand up at your face.
Do you see that a lot? People that
every
are
day.
really,
I have patients that walk in and they walk in with a tissue or a hand over their face because they're embarrassed to show me what their teeth look like.
Even
I've
you
never
as a
seen
dentist.
something that bad before. They feel like I am the worst patient you're ever going to see. And believe me, I've seen much worse on more people. So it's one of those things.
But you
where
say these people just don't smile.
They don't smile. I have one patient, she says, my husband won't ever smile. We have all these family pictures, and he's sitting there just not even smiling. And it's just tragic because, she's a beautiful lady, and he's a good-looking guy, but he just doesn't like his teeth.
So the wife drags him in.
Yeah.
Okay.
Yeah, says, what can you do to help him?
All right.
So.
And so with cosmetic dentistry, is it more men, more women? It's probably more women, right?
It's almost equal. It's maybe a little more women, maybe 60-40%. But I'd say we do a lot of men, but with a lot of ladies too. So.
But what about in this economy, though? Investing in like cosmetic or a smile maker in this economy?
Well, I think it's very important. One of the things I've noticed is that patients who take the time and the effort to invest in themselves open doors for opportunities. And you take two twin sisters that look identical, and you have a resume and you look at them and you say one's smiling and one's not. Most likely, if they have everything exactly the same on the resume, I'm going to hire the one that's
one looks happy.
Yeah, you want to hire happy people that love what they do. And I've noticed a lot of people who've come in and done little things to enhance their smile and make themselves look better. They feel better about themselves. They're more confident. So when they go into interview, they've had the opportunity to get a better job, or they've been able to get a job after seeking for employment for a long time. So, the way you appear and the way that you feel about your appearance is huge in this time of economy.
So you say with a lot of people, though, it really does change their appearance, their look. You brought some photos.
Yeah.
So what
changes everything about them. It changes their self-esteem, their self-confidence. Let me show you about this first patient. This is so this patient had a traumatic injury when she was a young girl. She got kicked in the teeth doing a cheerleading stunt and knocked her tooth out. Gorgeous, cute young lady. So when she came in, she was complaining to me that she didn't like how this one crown looked in the front. It didn't match. It was short. Gum tissue was a lot lower, so her teeth didn't look the same. And the color wasn't what she wanted. It was yellow, and that way she was kind of limited. She wanted a whiter, brighter smile, but didn't want to be able to just change one tooth. So I want you to take a closer look at this picture, if you will. There's certain teeth on those that are, short, discolored. They have some spots on them. Not real attractive.
Now, when you see this, do you see like the end result where you say, boy, this is going to be good?
Oh, yeah. Because I can I've done enough of these over the years that I can visualize it and I can say, I know what I can do to help this person have the smile of their dreams. And so I kind of get excited right in the consultation, and I'm like, my patients are kind of looking at me like I'm a little strange, but I can kind of, my assistants know what I'm doing because I'm kind of seeing, okay, I know what we can do to make your life change in the better, and it's going to be awesome.
Okay, so with her, what's your diagnosis? Like when you look at this with your eye, what do you see?
Well, she's got a lot of extra tissue. She's got a gummy smile. So we did some soft tissue contouring with some lasers. We added length to the teeth, and when we whitened and brightened all of her smile, and then we added thin porcelain veneers all over the top of them. So her restorations or fillings and crowns were all replaced with new, all porcelain.
Let's put up the after.
Okay.
Wow, very nice.
Yes. Okay, let's put those side by side. Now look at the difference between before and after. Look how she's beaming. See the twinkle in her eye? I mean, she looks
like a woman. I mean, she looks like a woman.
She's gorgeous, yeah. And she's
very
very
it's definitely
confident.
a prettier look.
Absolutely. Sure. And you know, the beautiful thing about that is, you know, I asked her the other day when she was in, I said, how are you doing? She goes, I can't stop smiling. I love my smile. I appreciate all you've done for me. Absolutely. It's changed her life. Let's take a closer look at the after. If you'll just look at what makes up a beautiful smile.
All right.
Look how pretty the teeth are. The two front ones match. They're the same height, the same width. They basically follow the contour of the lower lip line when she smiles, and it's very attractive. We also placed veneers on all of her upper teeth that show in her smile zone, and it just kind of makes everything in harmony so that everything blends in the same color, same contour, same shape, and it just adds to, it doesn't detract from the eye. It doesn't draw attention to it, and it just gives us a greater look. So you notice on the before, she has kind of short, flat teeth. Okay. Now she has longer, rounded teeth that look really more youthful, and it just really is added to the whole look for her.
Now, you know, I told you respectfully on the way that I feel like I could spot veneers a mile away.
Yes,
they seem
and
big.
I can too.
Oh, you can too.
Yeah,
because
my
they're
wife
big
hates
and
it when I'm at dinner and we bring that out, and she's
they're
like,
big and bulky. I mean,
walk.
So is that in the hands of the dentist, or is that?
It's both.
I don't think people want that, right?
Well, I think some people want.
Give us the inside scoop. Whose fault is that?
I think it's a combination of both, because some people want wider, bigger, brighter teeth, and I sometimes have to talk people down off of that and say, look, we want it to look natural. We don't want your teeth walking in the room before the rest of you. And it's kind of a phrase I use all the time, but we want something to be enhance their smile and to look gorgeous and beautiful, but we don't want to go too far. So if you go too big, too bright, it might be a little too much, and it's a little obvious. So we want something to look like nothing's ever happened. We just want a perfect, gorgeous, natural looking smile. How
do you help them know? Because it seems like the fear might be.
Sure.
What is it going to look like?
Absolutely.
So how much say-so do they have in that final result?
Well, I like to use what we call the test drive smile. When we go through the process of preparing the teeth,
smile, really call it.
We try to give them an opportunity to take it around the block, if you will. So what we do is we prepare the teeth. Beforehand, we prepare the with molds, and with the help of my lab clinician, we actually create a wax up or a model of what they should or could look like. And then from there, we transform that into the mouth using acrylic temporaries. And so
they can see it.
They can see it even before we even numb them up. It's kind of a nice thing. We can go in and give them a look, what they're going to want to look like, and it's that way we can check the fit, the aesthetics. If they talk, we don't want them slurring their speech. We want them to be able to enunciate words. We want them to feel like the teeth fit inside their lips. We look at the lips as the framework of the smile, and so if they've got teeth that are too big for that, it's not going to work. It's
so this test drive smile, so they look in the mirror. Do they ever say, that's it, that's what I want?
They do, and the nice thing is we can make little adjustments during the acrylic, so when the porcelain's finished and bonded in place, then it's going to be a great fit. It's going to look good, it's going to last a long time, it's going to hold up well with their normal function in chewing and biting and smiling and doing it.
So what's the turnaround time? Okay, if everything works out perfectly, somebody watching this, they don't like their smile, they go into you, time-wise, days-wise, how soon can they get?
Less than a month.
Really?
Yeah. We usually sit down and meet as a consultation. We take study models and photographs, take a lot of digital pictures and photographs and everything, communicate as much as we can to our lab technician to help us create the ideal case. We create a wax up. It's kind of like a blueprint or a model that an architect would do before he builds a building. We're not going to go out and dig a hole and start pouring cement unless we know what the building's going to look like before we start. Okay. So we start with the end in mind, and that way that we have a real predictable end result. So the patient loves it. We get the ideal fit, contour, color. All those things are built into the case as we go along. So it takes about 3 weeks for our lab to process everything and to get it back. So we
have a couple of trips, 2-3 trips to the dentist?
We usually require 3 minimal trips, and I like to see them a 4th time just to kind of touch up and fine tune any adjustment with the bite and make sure everything's good. So it works out really good.
So if there are a lot of people, you say thousands of people that don't like their smile, is it their fear of the dentist? maybe they're overestimating the cost?
I think
Why are there so many people that don't do anything then?
Well, I think they
What's your
feel like
take?
it's going to cost a lot of money. They feel like it's, some people are phobic of dental procedures. They're afraid of the needle. They're afraid of this, that, and that. We offer a lot of options for those. A lot of times we'll sedate a patient when we're doing the.
So you do
prep work.
sedation
We do,
dentistry there?
Absolutely. And
Do people
makes
tell you they
them more
don't like the
comfortable.
dentist, by the way?
Every day. What they say to me is they're like, I hate the dentist, but I like you. So how does that work, So I don't try to take it too personal. I kind of chuckle and rub it off, and I've got pretty thick skin, so I'm good to go.
I know people that know you, by the way. Everybody likes you.
Oh,
By
good.
the way, one of my friends that he's a consultant, and he went on and on about. He goes, "This guy's like a big teddy bear, nicest guy, but he's also excellent at what he does." So good for you. Now you have more photos. What
I do.
else? What else are
Sure.
we looking at?
So this woman came in to me and she said, I don't like my smile. I said, well, what don't you like about it? She goes, well, my bridges in the front don't match. They're different colors, and I have this huge gap.
So she's
in the
missing
front.
teeth in the
She's
front.
missing
Okay.
some teeth, and so they tried to go in and cover up the missing teeth with the bridge. She also didn't like this dark line along the gum line on
the
one
left
of her
corner
crowns.
of her mouth.
Exactly. She didn't like that because it showed when she smiled. So we decided to do new crowns and new veneers and also some new implants to cover up all the missing spaces. And so we got rid of all the metal and we gave her a gorgeous smile, and what I think is turned out
Very
amazing.
nice.
This looks very much more feminine and softer looking. Everything matches. It's the same color, the same length, and it fits in her smile, in her lips, and it outlines it nicely, and I just love how it turned out. It gave
So that's
her,
porcelain veneers.
everything's all porcelain.
Okay.
Yes.
So what does she say when it's done? Do you recall?
She was just thrilled because, she was so excited that now everything looked perfect, and she was so excited that, now she had more self-confidence in her smile, and it was hard for her to keep from not smiling all the time.
Okay.
She's been a great patient ever
And
since.
that gap, some people don't mind the gap, but she hated the gap.
She couldn't stand it. That was what drove her crazy. And that was kind of probably the worst thing that was about her whole smile, that she didn't like herself, that she wanted to correct. But we wanted to keep things in proportion, so we had to kind of adjust all the teeth at one time, not just the two front teeth. Let me show you something about the after that I love. Okay. If you look at the before, the teeth are kind of opaque. They don't match. It's because they're blocking out the metal underneath the bridges. Okay. We used all porcelain, so now the natural light blends through there. And so it looks very youthful. It's very beautiful, and it looks like real teeth. It doesn't look like a crown or a veneer.
Yeah.
It looks like something that would just Mother Nature would have given her. We also look at the length a little bit longer, and we close the gap nicely in proportion, so the front teeth all blend in nicely, so there's no two big front teeth. It's all in harmony with everything else.
So do you ever have stories where the patients say, because of this, I got a better job, or, I'm
Absolutely.
dating again, or whatever?
Yes, I can think of one exactly. This patient, we basically went in and did a smile makeover on him. And at the time, he was single, working, trying to get through, divorce. He was just down on his luck. Things were going bad for him. And we basically went in and did a smile makeover on him. And I asked him the other day when he was in, I said, so how has this changed your life? He goes, oh, it's given me a world of confidence. I basically have changed my whole life. I've remarried. I have a wonderful wife. I love her. I wouldn't have the courage to go up and talk to her if I didn't have the smile that I have, because I was so embarrassed of how I looked. And so the word he used was confidence. It gave him a world of confidence. And that to me is what's worth all the effort of going through this and having this opportunity to help people's lives change.
So you could take a person that just didn't smile, and
never
now they're
smiled.
smiling.
He's smiling, he's happy, he got a new job, he's married. Things have just, basically his life's made a 180-degree turn because of the self-confidence that he has with his new smile.
You must see it when you're out and about.
Yeah.
Can you spot, do you have a hypersensitivity toward people hiding their smile?
I do.
What do you say to them right now? Like, if they're watching.
There's so many things that can be done. It's not a big financial obligation. There's certain things that might cost a little bit more than others, but just subtle little things can make a huge difference. And we can make a difference in anybody who's not real happy about how they look right now.
Okay, good. Now we have time for a few more photos.
Okay.
What else?
Sure. Let me show
Are
you
you
this.
saving the best for last by any chance?
Oh, sure. Yes, I am.
All right.
He comes in and he doesn't like his teeth. He won't smile. We kind of had to, nudge him a little bit to get these photos of him, the pre-op photos, and he just wouldn't smile. His wife told me that, every picture they have of them together or family photo, he's not smiling. She's got a gorgeous smile.
So it was the wife's idea to get this guy
She was pushing him in, kicking and screaming, but he finally came in.
That's bad teeth right there.
Well, he's got a lot of issues. He's got a lot of breakdown.
Is that rare? Is that rare to see something that bad?
No, it's very common, but I think we don't see it as much because people who do have this problem kind of hide their teeth. They keep their tight lips, and they've learned how to train their smile so they don't smile with their teeth showing.
So what do you do for this guy?
Well, we basically went in and rebuilt his whole smile. We took away all the decay, got rid of the old metal fillings, and we used all porcelain fillings and crowns and combination of veneers and things like that to kind of create an ideal restoration. We basically did a full mouth rehabilitation on this young man, and it's made a world of difference. He loves his smile now, and his wife loves his smile, and it's so fun to see them together.
He doesn't look like the same guy in the after. I mean, look at the difference.
Oh yeah, it's
looks like
changed.
he could be a model or a professional soccer player or something. He looks like something, right?
Well, it's made a big difference in his life. He's so much happier. I ran into him at a restaurant a couple months ago, and they were just excited to see me.
Does his wife say he smiles now?
Oh yeah, she's smiling all the time. They went and got a family picture afterwards, so it's probably hanging in their living room right now.
But is he a lot of people?
He is. There's a lot of people who have put things off because they're worried it's going to hurt, it's going to cost them a lot of money, and there's, my suggestion is you got to start somewhere, and the more you put it off, the longer it's going to be, the more work we're going to have to do to help you. Here's another patient. This is probably one of my favorites, and I love when I see this patient because to me, we did very little dental work on her, but it had a huge impact. If you look at the upper teeth, the before shot, she had some bonding, the teeth were crooked, they weren't real straight, but she was a beautiful lady. She has a gorgeous smile, but when she'd smile, it wasn't the perfect smile. And so we went in and did 4 veneers on the 4 front teeth, and you can see how, from the after shot, how perfectly proportioned those are, how they've just melt right in and out, and it looks very natural. It doesn't look like anything else has been done. Here's another smile I'd like to show you. This one is an older smile. This gentleman walked in and he presented with old teeth that were yellow, broken down, chipped, worn out. His teeth looked older than he did.
Okay.
And so we gave him a wider, brighter, more useful smile.
Very nice.
It just made a huge difference in his appearance.
And those are veneers?
Those are veneers, yes.
Okay. Final message. Somebody watching this, and we're out of time. Great stuff. And all these photos are on your website.
Yes.
Is that right? Okay. Somebody doesn't like their smile, and for whatever reason, they're hesitating.
Sure.
What's their first move?
I'd love to sit down with you and talk to you about what we can do to help you. There's so many options out there, and everybody's unique and has their own options that we can work with you. I'll bring you in, give you a free consultation, X-rays, photographs, whatever we need to do to kind of give you a treatment plan. We want to help you and do whatever we can to make your smile better.
I'm surprised, by the way, that how many doctors. I make an assumption that all dentists are giving free consultations. That's not the case.
Probably not.
My office manager, she called. One was $350. I said, well, you got to call a place that's giving you, free consultation at least.
Yeah, absolutely.
So good. So you give them X-rays, then you give them a treatment plan, and you have financing available, things like that.
Yes. So we have all sorts of in-house financing available to afford some of these things. It's a big ticket item. Most people just can't write out a check for some of the things we're going to be suggesting they do. So we do have financial options and low monthly payments or low interest rates. So there's lots of opportunities to help get this.
What do you want
done.
people to know about you, by the way, as a dentist?
Basically that I'm here to help you, and I want to make your life better. And I love what I do. And seeing people's lives change is the best part of helping people. So changing lives one smile at a time is my motto.
All right. I want to thank you for coming on the show.
Thanks, Randy.
Great info.
Appreciate it.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like a smile makeover and want to see this interview again or caught just the end of it, you can go to wellnesshour.com, put in Dr. Pitts. You'll find him there. And for those of you that want to say something nice about Dr. Pitts on Twitter, it's hashtag The Wellness Hour on Twitter, and you'll find him there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.